You're listening to Everyday Evidence, presented by the American Occupational Therapy Association, helping the occupational therapy practitioner apply evidence to practice. Here's your host, Matt Brandenburg.
All right. Today we are joined by Dr. Britt St. John, an occupational therapist, researcher, and Fulbright Scholar whose work connects families, communities, and public health through participatory research. Brittany's studies have explored everything from mealtime routines to microbiomes and even the sensory science of chicken nuggets. Her work reminds us that inclusive design and community partnership aren't just research ideals, they're practical tools for building healthier, more connected lives. Britt, thank you so much for being with us today.
Yeah, I'm excited to be here.
Yeah, I've been really looking forward to speaking with you and learning from you and sharing some of your research and your perspective with the OT community at large. Can you introduce us to a little bit of your research and background?
Yeah, so I consider myself to be an autism and IDD researcher with a lifespan perspective. So that means that, as you've already mentioned, my topics are feeding challenges and inclusive participatory research and chicken nuggets and access to services and intervention. It's kind of all over the map. And I am an occupational therapist. I'm trained in public health, and I love research, and I like to bring those three things together.
That's beautiful. And I think you've done something wonderful in your research in that you've really demonstrated how occupational therapy research can meaningfully partner with autistic communities, with IDD communities, and with families to co-create interventions that work in real life.
Thanks. Yeah, that's a big compliment.
Of course. Thank you for doing that research and emphasizing that. I think, that's the crux of occupational therapy. And that's what we hope to encourage and connect you with other OT professionals who are hoping to do the same. I've noticed in your writings, and Britt, you use the term OT brain to describe the way occupational therapy practitioners analyze problems. Can you unpack kind of what that means in your own research context?
Yeah, I think I sort of adopted that term as a graduate student when I was talking to people outside of OT. A lot of my collaborators are outside of OT. And it was an easier way to package our expertise in activity analysis and how we like to dissect and think about a problem from the perspective of the person, the occupation, the context, and not just the immediate context, but the external, social, political context as well. And I think that it allows us to really tease apart complex things and approach it from multiple directions to come up with a lot of innovation. And I find that people are really surprised at how good OTs are at problem solving and breaking down complex ideas, even when we're not talking about occupation.
That's like the OT superpower in a way.
Yeah, totally.
I love that. Some people call it OT brain, OT lens, OT soul even, I think is a good one. What first drew you to apply your own OT perspective to study eating and family mealtime experiences?
Well, I think some of it is luck. I ended up at UW-Madison paired with Dr. Carla Osterau, who has a strong history in feeding and eating and mealtime for autistic families. And one of the first projects we did in my master's work was evaluating recorded family mealtimes and looking at what parents were doing to support eating, what sort of strategies they were using. And I was surprised and excited by how complex mealtimes are. I think we all have a scheme in our mind of what mealtimes are based on our own childhood and current setup and family structure and cultural and ritual practices. But to really dive into the diversity of that and think about strategies that were used across the board and strategies that were unique to each family was a really deep dive into mealtimes. And then with that, we also got to analyze some interviews from parents talking about how impactful feeding challenges were on their daily life. And I think this immediacy of family mealtime and how frequently it happens in daily routines just it just rose to the top for me as something that I felt like I could make a difference in, but also something that would have a big impact for a lot of people.
Absolutely. That's part of the beauty of occupational therapy, is respecting and acknowledging how important daily routines, including mealtime, are to an individual and a family, and how cultural practices or learned habits really impact those things over time, in addition to the environment and personal factors.
Yeah.
In your work, Britt, how do you bring a systems level perspective on the person, activity, and environment to your study of mealtime and feeding?
Well, I think what's wonderful about that is I started looking at families, right? I wasn't looking at a specific kid in a clinic. I was looking at a family from the beginning. So I think my framing for mealtime has always been with a family systems lens, even before I dove into graduate work. But it really rapidly evolved into thinking about how this challenge within an isolated family was so heavily influenced by where they lived, their access to food, if their concerns about feeding had been taken seriously by their primary care provider, or how close they lived to someone who was an expert in feeding intervention, and how long that wait list was. And it clearly had this unfolding system around it. And I think that that applies so broadly in OT. We often talk about ecological systems theory or dynamic systems theory, and we look at systems naturally. So it was just a beautiful fit.
That really is a beautiful fit. Britt, I want to ask you, what are some of the biggest misconceptions about selective eating in autistic individuals?
Oh, I think there's two that I am constantly butting up against. The first is that there's still this huge prevailing perception that parents are responsible for how their children eat. That anytime you see a picky eater, it's the parent's fault, or it's something about how the family is presenting food. And what we know is that it's so much more complicated than that. There's health factors that come into play. There's gastrointestinal symptoms and pain. There's sensory processing challenges. There's learned behavioral patterns, a drive for sameness and consistency. There's food access. Like, there's so many layers to that I just think we need to let that go, right? Parents are not responsible. And then that also brings up so much shame. And so I think families delay access to services or delay communicating concerns because of that prevailing misconception. And then the second is that we're still facing providers that don't really understand how intense selective eating can get. And they approach it by saying, well, all kids get picky, they'll grow out of it. Let's just wait and see. Let's monitor. They don't understand how rapidly it can evolve into a really significant health concern. We need to stop blaming families, and we need providers to take families seriously, really is what we need to do.
Yeah, absolutely. Absolutely. What would you say to a family who might be struggling with some of that shame or some of that guilt as their child is struggling with eating and mealtime?
Yeah, I mean, that conversation comes up a lot. I still have the opportunity to work one-on-one with families. And I almost always get the opportunity to have a conversation to say, this isn't your fault. You didn't do this. But also, you're not the only family who's having these challenges, and talk about just how prevalent it is. We see estimates of upwards of 80 to 90% of autistic kids are selective. There's now research coming out with autistic adults talking about how selectivity is a lifelong challenge and really closely related to their sensory processing challenges and their ability to regulate in the world. And sometimes framing it like that for a family really reduces the shame, and we're able to move past that in that conversation.
I love that. That's a wonderful way to frame it, and a wonderful way to encourage community, and helping each other out, connecting with other families and individuals who are experiencing the same thing. And what about providers who maybe aren't understanding the scope and breadth and impact of challenges in selective eating? What would you say to them?
I mean, I would love to sit down and have a detailed conversation with providers about the impact, and it would need to be a long conversation. But we're actually working on an echo project, which ECHO is a model for like peer learning. You host kind of like a focus group with a specific group of people, and then you deliver some content and then they do peer learning together. But we're developing an ECHO project for providers, really to think about what do you already know about selective eating, and specifically pediatric feeding disorder, and where are the gaps and how can we fill those gaps? Because it's a known challenge that these providers are sort of deferring families. And so we're trying to address it right from the like provider education standpoint.
I love that. We'll have to have a discussion another time about these ECHO studies and your peer learning developments.
Yeah, I'd be happy to do that.
That'd be awesome. Britt, we're focusing most of this episode on how occupational research meaningfully partners with communities and families to create these interventions. Recently, at the 2025 Occupational Therapy Summit of Scholars, you gave a lightning keynote that was titled From Focus Group to Chicken Nugget. Can you introduce us to this project? How did it begin?
Honestly, it started from a place of deep curiosity and a strong history of autism collaboration, and then a little bit of luck. The key piece of information here is that I was on Fulbright in Australia and was in this rhythm of just meeting as many people as I could who had any interest in eating and diet and intervention. And so I had been meeting with nutritionists and microbiology people and food innovation, just casually trying to learn more about their work and think about creative intersections of our work. And my Fulbright was at the Olga Tennyson Autism Research Center, which has this beautiful, long-standing collaboration with the autism community. They're well known. All of their work is participatory. It's a wonderful place to be a researcher. And I was doing work with autistic adults and asking them about their selective eating and their sensory perceptions of food and how that was impacting their food choices. And we were invited to a launch for a new research center, and that came with an opportunity to pitch a project. And all of these casual connections with all the other departments came together to launch a really exciting and rapidly developing project where we developed a sensory modified microbiome targeting chicken nugget.
That's fascinating. And I want to hear all the details about how these partnerships and this study really grew and developed and created such a wonderful, food item. But what were kind of the main things that you learned from the original focus groups with autistic adults about their own sensory experiences and eating preferences?
Well, I think some of it was expected, right? We knew sensory processing had it was a big contributing factor to feeding selectivity or eating selectivity. But we just wanted to know more about it, and we wanted to hear from a first person perspective. And so what was coming out was how safe it felt to have food that was predictable and that they knew exactly what it was going to feel like, taste like, smell like, in their system. And so they talked a lot about being drawn to really repetitive diets and really selective diets and having a hard time expanding because they needed to know that it would feel safe. And then as the group was discussing, they were talking about how often they used breaded chicken or a chicken nugget as a safe food that was able to deliver protein. And it was like their go-to item in a restaurant and their quick thing to throw in the air fryer when they weren't sure what else to eat. And it was just this like constant food that came up. And that also comes up in pediatric feeding intervention. You know, almost every kid I've worked with has some form of a chicken nugget in their diet. Not all of them. That's definitely culturally specific in some ways, but it does come up a lot. And then they were also talking about the importance of crunch and texture consistency and, things can't be soggy. So there were lots of things that could help food innovation. We just didn't know that was going to be applied yet. And so then when we were listening to all this feedback and pulling this all together, it really was happening simultaneously with this research center launch. And they asked us to come up with a project. And while I was talking to people at my table it just sort of naturally unfolded. They were like, oh, what's a problem we could solve? And I was like, well, here's my expertise. I work with selective eating. This is what I'm hearing, and we know microbiome is disrupted. We know finding new foods is really challenging. And it just sort of snowballed from there.
That's so wonderful. The opportunities that this Fulbright scholarship brought about and making these connections at the Olga Tennyson Research Center. And then with the La Trobe Institute for Sustainable Agricultural and Food. And was that a conversation at the table? Did you have an existing partnership with them?
Kind of. So the La Trobe Institute for Sustainable Agriculture and Food falls within the same research theme as any diet or feeding intervention. So La Trobe sort of naturally lumped me with food innovators because I'm doing diet-related work. And so I had met several of the people who run and work at LISAF. And the launch that I've referenced a couple of times, sorry, I kind of jumped ahead a little bit in that without explaining, but LISAF partnered with the Commonwealth Scientific and Industrial Research Organization, or CSIRO, to launch the Australian Food Innovation Centre. And the idea was to develop new foods to address major food access issues. And what they were really focused on was like getting cereal grains that didn't have heavy metals and, cereal grains that were innovative and could be used in lots of different ways, or non-meat protein sources. Like they were for like the general population. But we were invited to the launch of this research center, and at the launch they offered pilot funding to a collaborative group who could come up with a project, and then we voted on which project to fund. Because I had met many of the people in the room already, I was sitting with lots of people who I was familiar with their work. So I was seated with the 3 microbiologists that I'd talked to about autism and microbiome and how that's something I think we need to look into more, especially for selective eaters, and if it is connected in any way. And I was sitting with the nutrition and dietetics team who are really familiar with the nutritional gaps for the autistic kids and thinking about supplementation. And then I was sitting with the expert from CSIRO in sensory modification. And so the conversation really unfolded where I was saying, sensory challenges are dominant for selective eaters, and they tend to have really repetitive diets. And is there a way for us to think about creating food that is sensory acceptable, that also has some specific health benefit? And then everyone at the table was like, yeah, we could look at hybrid fiber delivery to impact microbiome, and we could think about complex proteins that have soy and chicken base so that we get like more diversity in the diet. And we had the clearest story of, here's a population that has expressed that they're interested in this. They've maybe not directly, they've never asked me to make them a chicken nugget, but there's enough lived experience statements that are related to this that I think we have some indication it could be acceptable. And we had all the people at the table who could make it happen. And so we ended up with the pilot funding and got to run a chicken nugget microbiome trial, which was an absolute blast.
I love that. What a wonderful example of interprofessional collaboration, as well as inclusive design that grew from focus groups with autistic adults into these beautiful partnerships and a very cool and innovative pilot study. Can you walk us through this Nugget pilot study? What were the key questions you were trying to answer with this team?
Yeah. So really, we were trying to do a proof of concept study. So we wanted to know, does the community even like this idea? Like, are they interested in a food designed to address microbiome differences and that we think matches their safe or highly preferred foods? And then would they even eat it consistently? Like, is that even possible? And then the biological outcomes of like, does it make any difference? So if we have someone eat a chicken nugget for 2 weeks, like, can we see any measurable change in their microbiome? And we really didn't expect anything to rise to the level of statistical significance. We recruited 12 participants. It was very much like a let's see if there's anything here, and then we'll design a larger trial after. But we got some really encouraging positive results.
I want to talk about both aspects of those results, both the proof of concept or acceptability results and the microbiome type of results. What was surprising to you about the acceptability results from family and adults?
Well, I think from adults, I was shocked at how many people were like, yes, I will eat a serving of chicken nuggets every day for 2 weeks. Not a problem. You don't even have to convince me. We had way more people interested in the study than we could even enroll. And we ended up just limiting it to people who were within a reasonable radius to deliver the nuggets. So we had people, from a really extended web, and then we had to kind of be like, I'm so sorry, you live too far out and we're going to reduce our shipping costs. I think for families, I've been working with families with selective eaters long enough that I know how hard it is to add a new food. And so we wanted to do acceptability, and I wanted to send nuggets to a family who had a child who was a selective eater, and then just get reports on their response to the nugget. And I didn't really anticipate that the kids would eat the nugget, but 80%, 4 out of 5 of the kids ate them on their first offer, which is, first of all, a huge win.
Wow.
Yeah, it's a huge win. And then not only did they eat them, but they reported that they enjoyed them, and they ate another serving later because we sent them with multiple servings for the family. So I think to me, it was saying like, okay, we've accurately created a food that seems approachable, and we're working with a population who's really comfortable with a repetitive diet. And so I think we're, headed in the right track.
That's so interesting. I love that this acceptability and the approachability of the product was emphasized from the very beginning. Mm-hmm. What were some of the biological outcomes, and how did those really connect to participants' lived experiences of enjoyment and preference when eating what is largely considered a safety food?
Yeah. So we measured gut and oral microbiome at baseline, at the end of the first week, and the end of the second week. So we got 3 time points, which was nice. And we also measured acceptability daily. So we were asking them, are you still liking it? What do you think? And we measured their diet variety at baseline. So it's very complicated, but we had them do a food frequency questionnaire that we then scored into how well they're meeting Australian dietary recommendations. And so they had a HDI score, Healthy Diet Index score. And what we found was there was a larger improvement in microbiome, which was improvement being there was a decrease in bad bacteria, the bacteria that overruns your gut. We saw a significantly decrease for the people who had the least variable diet or the lowest HDI score. They had a more rapid increase in microbiome health. And so the way we're interpreting this, and we're interpreting all of this cautiously, because again, this is really just, are we on the right track? This isn't a big enough sample to know, does this actually work? The way we're interpreting that is that we think potentially intervening for the most selective eaters might have the most impact on microbiome. And that's really encouraging, because there's some people with incredibly selective diets. And so we're really hoping that there's an opportunity there. The second finding that was statistically significant and exciting to us was that, again, that larger improvement in microbiome as measured by the reduction of bad bacteria was significant for people who had the highest ratings of enjoyment. So they liked the nugget the most and responded the best. And what we think that is pointing to is that there's this intersection of how much you enjoy a food and how well your body uses the food potentially. We obviously need a lot more information to know exactly what that means. But for me, I've been emphasizing the importance of finding expanded diet items that people enjoy eating. We're not trying to make kids or adults eat foods that they hate. We're trying to find more foods that they like. And this really backs that up with microbiome statistics, where we're saying yeah, your body actually seems to respond better if you enjoy the food. So we really want to emphasize enjoyment.
That is fascinating.
Yeah.
Yeah, that's amazing. What is tell me more about that, kind of this intersection between enjoyment and the way someone feels about what they're eating and the positive benefits that can come from it.
Yeah. So the working theory is that potentially you enjoy a food more if it's a good match for you, like it doesn't give you gastrointestinal symptoms, you're not allergic to it, and maybe even on a more granular level, like subconsciously, I don't know. We don't really understand that yet, but my nutrition teammates say that there's actually some good recent research coming out in the nutrition side of things that's also saying that people who enjoy the food seem to like absorb the nutrients better potentially. So I think what we know about the gut brain axis so far is that it's deeply interconnected and that there are a lot of questions about how what you eat impacts your body and your brain, and we don't have all the answers. I also think that we can expand slightly on this and say, like, we know these nuggets were sensory enjoyable as well. So it's not just flavor, it was, a full experience of eating them. And so there's potentially room for us to think about that intersection of gut health, nutritional health, enjoyment, and like sensory preferences when we're picking foods. And that's a complicated thing to do, but also a really exciting and innovative thing to do.
Absolutely. That research is really fascinating to me. I'll be interested to hear more how this study develops and how future directions of research integrate that intersection of sensory processing, nutrition, gut health, and this mind-body connection into their work.
Mm-hmm. Me too. I'm excited to see how it unfolds too.
Yeah. How might these findings influence how clinicians approach feeding interventions or nutritional counseling?
Yeah, I don't think that there's a direct translational pathway yet. It feels very cautionary to be over interpreting these results. But I do think something that you could safely move forward with is that enjoyment matters and that we should think about enjoyment and acceptability when we're helping people expand diets or think about foods that might be a good fit for their repertoire. Both as OTs who work with diet expansion, but also like the nutrition and dietetics field should be thinking about that too.
Absolutely. I love that we're part of a profession that emphasizes and gives direct attention to someone's enjoyment and acceptability of rehabilitation, no matter the context. It seems like that's a principle throughout occupational therapy.
Absolutely. I mean, at the core of OT is client-centered practice. And I think this is just another example of how to apply that.
How would you recommend practitioners or families themselves or individuals could navigate selective eating or mealtime challenges while encouraging that enjoyment and acceptability?
I think that's kind of a two-part question. So for clinicians or practitioners, I think something that's really important is to find your connections or your community of people who are also thinking about selective eating. We all have gaps, we all have focus areas, we all have strengths. And I think even if you're not co-treating on the same person, you can still collaborate in ways that expand your practice. There's some really cool opportunities nationally. Like there's Feeding Matters is an organization that connects clinicians across disciplines focused on pediatric feeding disorder, which selective eating would fall into that classification. But anything you can do to connect with other people who are thinking about it. I think my work in particular shows how important it is to build even casual relationships, because sometimes they grow into not casual relationships. And so this whole project came from just getting to know people who are doing similar work. Take the time to do that. And then for individuals and families who are navigating this, I think it's a similar answer of like, you need to find people who are also navigating it. But I would encourage you to just be the squeaky wheel. Like, there are going to be providers who dismiss you or don't take eating or mealtime challenges seriously. And if you think there's a problem, there is a problem. And you need to find someone who can help you solve the problem, because it can unfold rapidly. And I think there are services that work, and we just need to get you connected. So don't give up.
I love that. Those are excellent recommendations, Britt. And it's just a testament to your work of how you've been able to connect individual level research to community and systems level impact. And at this point, I see that as evidence that this OT brain and OT approach really scales well from an individual to a community. How do you hope that continues to play out in your work?
Well, I love having my foot in a clinically focused and service level or systems level place. I really like to span both of those. And I just don't see that ever getting consolidated in any way. Maybe I'll run out of capacity eventually, but right now I'm just so happy to bounce back and forth from those. And I think that really keeps me connected to providers, clinicians, families, and like hearing what's happening, what's the problem right now, what can we be working on, and then bringing that to a zoomed out perspective to say, like, okay, where's the challenge at the systems level? Where's the challenge at the policy level? And work on those simultaneously. So right now I'm really focused on, the Chicken Nugget project is amazing, but I'm really focused on service access for feeding intervention. I'm in Washington State and have been since the middle of 2024, and wait lists for feeding services here are at least a year, but more like 2 to 3 years. And so, right away, as I was building connections here and meeting families and clinic leaders and other people working in feeding, it was just coming up over and over and over again, like these wait lists. And so I'm trying to pilot waitlist interventions to address it at like let's get services to families as fast as possible, but also looking at a health services lens of like, where are the leverage points in the health system where we can shift access and improve waitlist time. And I think that is a lens that I can apply to almost any research question is, what does it look like clinically? And then what does it look like at a policy and systems level?
I love that. Thank you. That clinical and policy perspective can be so powerful. I know these community partnerships were integral to your Nugget pilot studies. What have you learned over the past year or so since you've been in Washington about how to establish community partnerships that guide your research and ensure outcomes are broad enough to impact the people you want them to?
Yeah, I really try to just stay open to any connection. So if I'm talking to someone and they're like, "Oh, have you met Gary?" I'll say, "No, I haven't. Could you introduce me?" And then we will meet Gary, or have you met, whoever? And that has just rapidly expanded my network of people. And sometimes there isn't a clear intersection in that person, but it is still wonderful to have a conversation with someone who maybe a tiny piece of their work overlaps, and maybe in a few years more of our work will overlap. So I think both formal and informal connections are really powerful. I also think that it is so helpful to have people who are excited about your work, who are further along in their career. So when I started in Washington, I met multiple people who were further along the faculty pathway, who were better connected than I am, who were excited about my research and took the time to introduce me to lots of people. And so if you're junior or, brand new as an OT, like, find your senior mentor who can point you in the right direction. And if you're senior, take the time to mentor junior people, because we need stronger community clinical partnerships. And you have power as a senior person to really launch those in a meaningful way.
Absolutely. I love that call to action, Britt. Thank you.
Yeah.
What would you say are some barriers to including people with intellectual and developmental disabilities in research? And how would you propose that occupational therapy could change that?
Well, there's a lot of historic barriers. There's really specific systemic exclusion of people with intellectual and developmental disabilities because for a long time, they were considered as not capable of consenting to participate in research. And that is changing, thankfully. It does take a lot of intentional work on the point of a researcher to build it into your research plan, your recruitment and consent and assent plan. One barrier is just the research infrastructure in general. And then people who do research are really short on time. And so sometimes it's easier to have more exclusionary criteria and to, recruit college students instead of community members or whatever it is. And so you get less representation. But again, I think that's changing. One of the biggest facilitators of people with intellectual disability participating in research is just making accommodations available. Making it possible to have a support person with you, or making space for multiple forms of communication, or slowing down your consent process. There's lots of things you can do. And I think OTs are actually so perfectly suited to facilitate that because we are experts at adaptation and accommodations and identifying what allows participation to be possible. And so if you approach research participation as an occupation and say, where's the barrier? How can I facilitate participation in this occupation? You're ready. You're ready to be a part of the team that brings in more representation.
Absolutely. More research teams need OT specialists who can see research participation as an occupation.
Absolutely, they do. I kind of think everyone needs an OT on their team.
Absolutely. What was your experience like in the Nugget case studies of having these focus groups and ensuring that the participants' thoughts, opinions, preferences were communicated appropriately and I guess brought to life in the form of this new chicken nugget that was developed by, I'm assuming here, nutritionists and microbiologists.
Mm-hmm. And food innovators. There was a lot of iterative processes happening. So, I took the original focus group results to the team to sort of launch the project. And then our first step was to come back to the autism community and ask, what's your openness to food modification? What's your response to a microbiome targeting chicken nugget? And we got really positive responses there. And then when we had a version of the chicken nugget ready, we had them taste test it and critique the sensory components. We brought in like, I think it was like 7 or 8 different versions of chicken nuggets that you can like buy in the store, and prepared them and literally did like a food focus group where we cut them open and looked at the texture and talked about the color and the breading and the crumbing and, what was the best part or the worst part. And essentially like collaboratively designed the ideal nugget. And then that's what we ended up with. And there are several people who have tasted the nugget who rave about how it's the perfect nugget. So I don't know if that would be true across the board, but it's pretty exciting to hear super excitement about this developed product that we worked so hard on. I think that iterative back and forth and continually asking not just what do you like about this or is this acceptable, but also what are your critiques? What would you change? Is there anything, that you feel like is missing? Yeah, and we got some really great feedback and developed an awesome product.
Yeah, that's such a wonderful model for participatory research, and to include that continuous communication. And, it wasn't just one focus group, it was a continuous process. Mm-hmm. How can I get my hands on some of these nuggets to try them?
Oh, I'm so sorry to report that they are still Australian based and will probably be for quite a while. I think we can all take a look at our geopolitical context and understand why importing a new nugget might be a challenge. But also we just have several more phases of clinical trials to go through, and those will all take place in Australia before we're able to think about marketing them as a commercial product. So stay tuned. Watch this space.
Absolutely. We'll stay tuned. Hopefully some OT practitioners can make it to Australia, or our OT practitioners in Australia can maybe give them a try.
Yes, that would be wonderful.
Yeah. Britt, how do you envision this model of research, of participatory research, shaping the future of disability and family health policy?
Oh, I think we are already seeing shifts in that. So I think participatory research has really been rapidly increasing in the last, 10 to 15 years for sure. And this prioritization of what families and individuals are reporting and what the most acceptable solutions are is already influencing policy. A good example is states that are moving away from just standard guardianship and they're moving towards like supportive decision making. So they're really valuing the individual's perspective and ability to make decisions at some level, and they're bringing in a decision-making partner instead of someone who's in charge, right? So really like leveling out the power balances. And I think that that's going to just continue to expand. Funders are already recognizing the importance of participatory research and having meaningful engagement across your project. And I think as that continues to grow, models like PCORI, where they require really thoughtful engagement or they won't even fund your project. And that's also becoming a requirement for other funding organizations as well. And then hopefully, as we see that expand in research, we will see it translate to policymakers. But I think that responsibility falls on us as researchers to make sure that our findings are digestible and disseminated in a way that policymakers can apply them. That means you can't just publish the journal article. You also need to do the community talk. You also need to do the one-page summary that goes out to the community. You might need to meet with legislative panels. Like if your work applies at a policy level, you have to be translating for them. They're not going to come and digest your research article and take away the most important pieces.
Absolutely. That's highlights some really important aspects of this type of research, but also highlights some really wonderful opportunities for occupational therapy to grow its scope, to grow its recognition. How would you recommend clinicians could adopt more participatory research approaches, even in busy clinical settings?
I think that is a really challenging thing to consider. One thing that I think counts as a participatory approach is a truly client-centered practice. If you have clients and families co-selecting goals and weighing in on intervention progress and providing feedback, that's a big part of it. And then I think anytime you can capture community feedback, like are there services that are needed that you're not delivering, or is your wait list getting out of control? Those kinds of things. And it might be as simple as like a survey on your website or a comment box, or I'm not sure exactly what it looks like, but try to capture the perspective of the people that you serve, both individually but also on a broader community level. I find a lot of value in giving short lectures or sitting on panels with my clinic hat on. I get to meet people that I would never serve clinically necessarily because I'm often traveling to do these, or providing them in a setting that I don't work clinically, and I end up hearing specific things. So like the waitlist thing kind of came up out of meeting lots of people in the community, and it was mentioned when I gave talks and talked to families. The Chicken Nugget thing came out of like getting to know lots of people in the community, right? Like take the opportunity to give the talk or go to coffee or, listen if you can. I know you're super busy as a clinician, but if you can.
I love those recommendations, Britt. And it's a wide range of options that clinicians, practitioners could participate in. And I love your emphasis of, first and foremost, be person first in your approach to care. I like to think that the best way occupational therapy practitioners can advocate for our profession is by providing the highest quality care and intervention that you can, and impacting the people we work with in a way that's uplifting and empowering to everyone.
Absolutely. Yeah. I mean, there's so much value in what you provide as a clinician. And if you're truly partnered with the people that you're serving, you are participatory. You might only be at the individual level and you would like to scale, but that is being participatory.
What additional advice would you have for occupational therapy practitioners or researchers or students who are interested in following a similar career path to yours, in which you're able to blend public health and occupational science?
First and foremost, you don't have to get a PhD to be a partner in research. We need more clinicians who are willing to let us buy out 10% of your FTE, or, consult with you on a monthly basis or something, because we need more clinic researcher partnerships. So you don't have to get a PhD. But if you want a PhD, come and get one, because we really also need more OTs in the research space. And you already have the lens, you already have the perspective that allows you to think on this systems level. You just need more training in how that translates outside of a clinic setting. And it can be really powerful. And also remembering that you don't have to be a faculty member or an academic researcher to participate in research. There's a lot of roles, and we would love to bring it all in. So if you have an idea, if you see a gap in the literature, please approach researchers who are local to you or not local to you. Send me an email.
Absolutely. With your permission, we can share your email in the description of this episode.
You absolutely can. Yep, I'm happy to take emails.
Wonderful. Thank you, Britt. You've already given us some excellent examples and recommendations for how researchers and clinicians can partner with communities and gauge interest and input and perspective from communities and individuals. How do you see the co-creation of solutions for eating or family well-being? How can OT professionals contribute to that specifically within a community?
I think OT professionals are really in a space to bring together what are the family concerns that you're hearing over and over and over again, and where are the gaps that you're seeing in your own clinical practice? Like, do you have enough time to provide feeding services? Do you need to be able to deliver them in someone's home? Do you need access to telehealth care? Like, what would make it easier for you? And then what are families identifying as the biggest challenge? You're perfectly suited to bring those things together and say, we need to study this solution, or we need to develop this solution. I currently have a pilot study going with a waitlist intervention, and it really came out of families saying, hey, we don't really know where to start with feeding. We don't have any of this like baseline information. We just know it's a problem in our house. We don't know how to approach it. And we're sitting on this wait list for 2 years, and clinicians are saying, I'm covering these same topics over and over and over and over again. What if we had a program for families to learn that really introductory information about feeding and selective eating while they were waiting? What if we could build their capacity before they got into intervention? And so we're piloting that. But that wasn't my brainchild. That was clinicians communicating the gap and frustrated with how long people are waiting. It was families who were continually saying, I've never heard anything about how sensory processing and eating go together. I don't know anything about building a mealtime routine, or I don't know if I should be letting them have the iPad at the table or not. No one's ever given me a clear answer. And so we're having this opportunity to pilot whether this education makes a difference. And I'm hopeful that it does, because it comes from a co-created idea, right? We built this First Bite program with collaboration from the community.
That sounds like such a wonderful research design. and something that can really address this issue of wait lists and people needing to wait for up to 2-3 years to start receiving care. Why not start the education process? I love that idea. I think that has so much potential to grow. And I think listeners and OT professionals can take that and hopefully apply it to their own practices as needed as well.
Yeah, I mean, you don't even need the program we developed, right? Like, you know what your families are asking for and the education materials you're giving. Like, is there an opportunity for you to have a program that's happening while they're on a wait list? Maybe there is. And maybe it's not just feeding. Maybe you're looking at a different area. But yeah, just be creative.
I love that. Britt, I want to wrap up with a couple concluding questions to hopefully inspire our audience and reemphasize some memorable takeaways from our discussion today. What's one thing you really hope our listeners remember about occupational therapy's role in participatory research?
I think that the most important thing is to remember that at the core of OT, we are client-centered, and at the primary goal of participatory research is to be centered in that lived experience. And those are perfectly aligned. And so your OT lens, your practice approach is perfectly suited to step into a participatory style project. So you're well on your way.
I love it. I love it. How could occupational therapy professionals advocate for and facilitate the inclusion of people with intellectual and developmental disabilities in health research?
If you are serving people with intellectual and developmental disabilities, please look for pipelines for research participation. So, are there studies that are recruiting that might be a good fit? And can you make that information available at your site? As a researcher, that's really valuable. I have a lot of community service providers that I'll reach out to and say, hey, I'm recruiting. I would like to have representation. Do you think your client population is a good fit for this study? And then they will distribute information. I think it can be really powerful. There's also a curriculum to help build the skills for people with intellectual disability to participate in research. It was developed in my PhD lab, not my lab, in the lab I did my PhD in. So Dr. Carla Osterau created the Research Engagement and Advocacy for Diverse Individuals, or READY curriculum. I'm happy to provide a link that can go in the description. And it was funded by PCORI and is accessible for people. So you're able to view the curriculum and use it. And it's really all around understanding what research is, understanding the research process, and then understanding the different ways you can be involved. So you can be a consumer of research, you can be a participant in research, you can be a research partner or a co-researcher, and it gives you a lot of tools to support that. So if you work with people with intellectual disability, I would encourage that you look into it because it might be a powerful thing to recommend.
Absolutely. Yes. Please send that link. We'll be sure to share it and direct our listeners to learn more about that READY program. Do you have tips for how a clinician could identify and connect with those pipelines for research participation? Is it connecting with researchers at universities, or how do you recommend a clinician go about that?
Yeah, so I think connecting with researchers at universities is a great place to start, but can feel kind of overwhelming. And there's a lot of variability in how people distribute recruitment information. But honestly, one of the most common ways that I recruit is to have my study information put on like an email newsletter that goes to subscribers. So like if you were subscribed to the OT department at UW, you would get my information. If you were subscribed to the newsletter from the Autism Center at UW, you would get my information. So thinking about what newsletters might include studies that you might be interested in, and could you be subscribing to them? Feeding Matters, that organization I mentioned earlier, they also have a newsletter, and they will occasionally recruit or include recruitment information in that for feeding focused studies. So I think it can be a challenging gap to cross, but looking for those connections. And then following people on LinkedIn actually is also a really great way to get recruitment information. Most of my research colleagues post their studies on LinkedIn. And so it's a good way to just capture what might be going on.
Absolutely. There's so many ways to connect in our technologically advanced world today. Thank you for those recommendations, Britt. For students and researchers and clinicians who want to learn more about this work and get involved in it, what other resources would you recommend to them?
I think finding researchers who are doing work that you connect with. So like if you like what I've been talking about, send me an email and find a way to stay connected with me. But do that with anyone that you're following, because our work evolves faster than it gets published, right? So like I don't have any published articles on this nugget study. So by the time you're reading it in an academic journal, I might be 2 or 3 studies down the line. But if you hear a podcast or you see a newsletter or something come out with something interesting, reach out to that person. And I think that we're, as a society, we're not super used to that right now, where we just like cold email people, but researchers are more receptive to that than I think a lot of people are. So build some confidence to just reach out. And then I think that there's some really awesome resources that come out of the AOTA conference. Like there's lots of poster presentations and like, I forget what they're called, but the ones where there's like multiple researchers who have a similar topic and they sort of like host a conversation near the posters. Go to those, because what you will end up doing is meeting not just the researchers who are presenting on interesting things, but you'll meet all the other people who are also interested in that topic. And like take your contact information and be ready to hand it out and like really work on networking. I find the poster sessions at AOTA often lead to the most fruitful connections that I've had in research. So it's a good place to start.
Absolutely. Building a community and having the courage to reach out and hope to make a connection can make such a difference. Britt, thank you so much for sharing your knowledge, for sharing your expertise with us. How would you like listeners to stay connected with you and stay updated on your research?
So email is a great way if you want to directly connect. I'm still a new faculty, love to make more connections with anyone who has similar interests. I am also accepting applications for PhD students, so if you're interested in that. And then you can also, I'm not super active on LinkedIn, but I am on LinkedIn, or ResearchGate is where you would see all of my like publications and presentations and things like that. So that's a good place to look as well.
I love it. Thank you so much, Britt. Really appreciate your time and sharing your example with us today.
Yeah, thanks so much for having me.
Thanks for listening to Everyday Evidence. Tune in next time for more evidence-based practice insights and applications.